My name is Gabby Glenn, and I work at Nationwide Children's Hospital with Carrie, and I do reproductive health programming in the middle schools. So I don't work with many adults, but we like to teach young people about these topics so that they can learn about things like birth control and prevention and health well before they begin dating or go into relationships. So thank you for having me. So I'm just going to talk a little bit about what we mean when we say women's health, what a woman's wellness exam is, and about family planning or birth control. So what is women's health? So that includes everything related to pregnancy, which could mean preventing a pregnancy, assisting someone with trying to become pregnant, fertility, ending a pregnancy, and then prenatal care. So going to the doctor during pregnancy and childbirth. And that also includes breast exams, cancer screenings, family planning and birth control, and sexually transmitted infections, which maybe you've heard STI, or some people call them STDs. And those are infections that can be transmitted through unprotected sex. So it's recommended that anyone, oh, do I already have a question? Let's see. Okay. Oh, wait, you can still only see the first slide?
Yep.
Oh, why? Oh, it says the screen is paused. Huh. Now is it good?
Yes.
Okay. So that's everything that I just said. So what is women's health? It's all of those things. Pregnancy, breast exams, cancer screening, family planning, and STIs. And if it's helpful, I can share this PowerPoint with Carrie and Liz, and they can email it to you all after. Is that okay? So it's recommended to anyone who has a vulva, breasts, or uterus to go to what's called a gynecologist once per year, starting when people begin having sex or at age 21, whichever comes first, or if they're having an issue. Of course, always go to the doctor if you are having an issue, a problem. So it's recommended to go once per year. And why is it recommended? It's all about prevention. So preventing diseases, preventing cancer. So that's what they do. They do tests and exams to screen for breast cancer, something called cervical cancer. And I just listed here some of the things that you might expect, maybe if someone has never gone to have a woman's wellness exam. So they might do a physical exam, just like at another doctor's office where they check your blood pressure and stuff. Oh, it looks like Pauletta's here. Should I admit her? They might ask some screening questions. Like sometimes they ask questions about relationships and safety and just different behaviors or activities that people might do. They'll do a breast exam, so feel the breasts for any lumps or bumps. A pelvic exam, which is where they actually put something called a speculum into the vagina to swab to test for cancer or cancer causing cells. They'll do a little bit of education and counseling to talk about things like family planning, and they might do some blood tests. They might do vaccinations. So that's what a woman's wellness exam is. And then another huge thing that gynecologists or OBGYNs do is prescribe birth control. So that's my next slide. So when we talk about birth control, we put them into 3 sections. So we talk about barrier methods, we talk about behavioral methods, and we talk about hormonal birth control methods. So the word barrier to get on a birth control, there's lots of different kinds. And so usually we say that people can find one that works for their life, that works for their body, and that maybe they just prefer. And I think in the United States, about like 98% of women have been on one of these types at least once in her life. So they're very common. And the ones I have here are the most effective. So anywhere from 92 to 99% effective at preventing pregnancy. So I put them into 3 categories because the short-term ones are ones that you have to use or take more often, more frequently. So the first one there is the birth control pill, and that is just a little pill. Actually, hang on, I have. Okay, here it is. I have like pretend stuff. So this would be like what the birth control pill looks like. And it's just one pill that someone would take one time each day, every day. Then the patch is the next one on my screen, and that's worn on the skin, and it goes on the skin for 1 week at a time. So it almost looks like a Band-Aid. So you put a patch on for 1 week, and then a new one week 2, a new one week 3, and then the 4th week there's no patch, and that's when the person has their period. The next one is the ring. This. And that goes in the vagina and sits in the vagina for 3 weeks. And then the 4th week, someone removes it and they have their period. So those are the ones that are changed more often. And then the long-term ones, so we have the shot, and that is just like any other shot at the doctor's office, like an injection. And that you have to go to the doctor, and it lasts for 3 months. So you go get a shot every 3 months. Then the implant, let's see if I have an implant in here. I don't, but it's a little flexible rod, just a little thing that goes into the inner upper arm right here. And that lasts for 3 years. So these ones last longer. Then we have the IUD, which stands for intrauterine device. And that is inserted into the uterus. So that one you have to go to a doctor and have it inserted, and lasts for 3 to 12 years, depending on the brand. And I made a note, there is one IUD that is made of copper that has no hormones. So there's lots of options. Then I also added emergency contraception because that is, it is kind of like a birth control, but it's to be used in emergency situations after someone has unprotected sex. Sometimes it's called the morning after pill. So if the condom breaks or something happens, someone could take that the next morning to prevent a pregnancy. Okay, so that's a lot of information. What questions do you have? Because I have, I think 2 more slides.
Nobody else has one? Gabby, can you go through which ones of these you need a doctor to like insert for you and which ones you can do by yourself?
Yes, that's a good question. So on my next slide, I have that all of these have to be prescribed by a doctor. So during that women's wellness exam, you would have a conversation with your doctor, talk about maybe your lifestyle and which one you think will work best for you. And then they would prescribe it. And you, for the pill, the patch, and the ring, you would have to go to the pharmacy and get it there. And those are all done on your own at home. The shot you have to go to the doctor to get, and then the implant and the IUD, the doctor has to insert. And then the emergency contraception is no prescription, and that can be purchased at CVS, Walgreens, Target, places like that.
In your professional opinion, is there one you would suggest is the easiest to start with or the most common to start with?
No, because every body is different. And I would just encourage people to talk to their doctor about which one they think will be best. I will say that some people know that remembering to take a pill every single day might be really hard. Maybe someone hates shots. Maybe someone likes the idea of an implant that lasts for 3 years. And once it's in, and they don't have to worry. So they're all very effective. And it just depends on the person and their preference. But that's a good question.
What about natural family planning?
Yes. So we don't teach that because I teach young people, and that is very difficult for teenagers to do. And natural family planning is a type of contraception, but it's just statistically, it's less effective than the methods that I have listed here.
Okay.
Yeah, so I'm not an expert. Many people choose natural family planning, but because I teach young people, I'm not an expert on that topic. So we just teach the most common and the most effective methods. But that's a good question. So how does birth control work? All of those work the same way. They stop ovulation, and that's when the egg is released from the ovary. I could talk about this all day, but I'll just leave it at that because there's other things that birth control does as well. But I will say that once someone stops taking birth control, depending on the kind, fertility or being able to become pregnant can happen right away, can happen immediately. So for some, like the shot, it takes longer to get out of the system. But for the IUD, people can get pregnant the day they get the IUD removed. And then the other thing that is very, very important that I didn't say is that these methods only prevent pregnancy. So they don't prevent sexually transmitted infections or those STIs. So if people are having sex and maybe they are having multiple partners or whatever the situation, we would recommend using a condom as well. Like I said, all birth control is different and all bodies are different. So talk to your doctor about which one you think is best. But like any medicine, there are side effects or effects that the medicine might have on the body. So one is changes in periods, which is that monthly bleeding. Some people call it menstruating, and that could make periods with more blood, less blood, or maybe even stop periods completely. They could make periods more regular so people know what day and what time it's coming. They can make cramping decrease, which is that lower stomach pain that some people have, and makes skin more clear sometimes. So less pimples, less acne. And my last slide is about where people, I had to reach out to a coworker who lives in Akron, but these are all the places that she recommended. So you all might know better than me, but Access Point, it looks like, has multiple locations. And she said that Access Point and Planned Parenthood would definitely be the most affordable. So they accept all insurances, Medicaid, and Planned Parenthood explicitly had on their website that they do language interpretation services over the phone. And then I think the Summa Health is where your next speaker works. And then everyone knows the Cleveland Clinic. So, and yes, we'll share these slides so people can click on those links. And that's all I got.